And what are your thoughts on these drugs like Ozempic, which are being used for weight loss these days? And are there any long-term side effects for these drugs?
Ideally, the Ozempic is not at all approved for the weight loss. It's approved for the diabetes only, but people are misusing it as a weight loss drug. So that's called initial fat loss. But see, any medication comes with the side effects. There's nothing like some people have, it can lead to pancreatic side effects and other things. Maybe the incidence is low, but medicine is a medicine. Any chemical, it has its own side effects in the long run. You cannot keep on continuing taking Ozempic for years.
Right.
When for a short duration of time, if you're a pre-diabetic or obese, you can take it for a few months, reduce the weight, and ultimately, what you have to maintain your weight, matlab, you have to follow the diet.
Right. I think it's just like Ozempic has been repurposed from a diabetic drug to a weight loss drug. Similarly, bariatric surgery has been repurposed as a diabetic surgery. So these kind of things keep happening, but the focus should be on holistic wellness always,
Yes,
right?
yes, 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 yes.
So moving on, is long-term intermittent fasting, can people do it for lifelong, or are there any sort of precautions one has to take with long-term fasting?
See, intermittent fasting, example, like we can more precisely we can tell them it's a pattern of eating. For example, you just recommend people to have a early dinner and a late breakfast. So naturally, you're fasting. For example, your ancestors was they finishing the eating by 6:30, and in the olden days there was nothing like a concept of breakfast every day, and they used to have a late breakfast. So early dinner and late breakfast automatically intermittent fasting.
Correct.
So there's nothing new. Like now the term is this one. Like my grandfather used to finish his dinner by 7 o'clock, and today next day morning I used to go to the farm and he come back and having breakfast at 11 o'clock. He used to have a brunch more than a breakfast. He used to have a brunch at 11 o'clock. So by naturally he was doing 16 hours fasting.
Right.
So if you make that as per your lifestyle, if you make that adjustment, automatically it become a pattern of eating. And something to be taken care of for long time people who are fasting, but don't go to extremes. Don't try to do every day 24 or 36 hours of fasting. And don't try to do fasting when you're already stressful. Because the fasting itself is a stressful state. If already you're some stress, physical or emotional something, avoid fasting. Otherwise, weekly 4 to 4 days, easily somebody can continue fasting.
Right. I think you mentioned earlier that people who are on medication should avoid fasting. Can you just elaborate a little bit more on that?
The commonly used medications in the diabetic are sulfonylureas. You might have heard this glycomet GP1, GP2, like this kind of things.
Yes.
These sulfonylureas are more prone to cause low sugars. And these some drugs act up to 24 hours. If you take once, they act up to 24 hours. So doing fasting with these medication is not good. And second comes insulins. So whenever you're having any insulins, no, the chance of getting low sugar is very high. So people who are taking sulfonylureas and these insulins, you must refrain from fasting. If they want to do fasting, I recommend not more than a simple 12-hour fasting. So more
Right.
than that, your sugar may vary and you're at high risk. Then comes DPP4 inhibitor, SGLT inhibitors. If you're in a small dose of these medications, you can go fasting up to 12 to 14 hours. And if you're only metformin, a simple metformin drug, then you can do regular fasting. But metformin is less known to cause any low sugars, and you can easily do 56 hours fasting with the metformin. But again, people have to consult the diabetologist more precisely. If he has experience about fasting, that will be good. Because not otherwise, most diabetologists say if it's fasting method, they will just no, that's not taught for us. No need to do fasting.
True,
Right.
true.
So, one question I have is, uh, there is a lot of link, or there is a lot of research coming out between the link between micronutrient deficiencies like magnesium, chromium, etc., and diabetes. Do you think that is one of the reasons we have so much diabetes cases in India?
Yeah, these are all additional factors. As I told you at the beginning, 70% we can attribute to diet. In the remaining 30%, all this will come. Chromium deficiency, magnesium deficiency, pollutants in the food, pollution we are exposed to, stress level, all this will come into effect. Definitely, we can't completely say no. All this will have an effect.
I think I saw one of your posts recommending these are like essential supplements. So, what are those essential supplements if somebody doesn't know much and he wants to not get into any deficiencies?
So there are. I always keep telling people at least 5 basic supplements. So one is nowadays the most important is vitamin B12 and D. You know, even if you do randomly blood test for somebody, you feel 50% people are deficient in vitamin B12 and D. So as per the reports, you take injection and tablets with a prescription of a doctor preferably, because I recommend with the prescription only, because I don't recommend somebody taking vitamin B12 from the Amazon, because pharmaceutical supplements are more regulated compared to nutraceutical supplements. And next comes the magnesium, very important supplement, because the magnesium deficiency is mainly because of the lack of the degradation of the soils nowadays, and also lack of nutrient density in the foods. So magnesium is one of the supplements which is much needed. And fourth comes omega-3 supplements, one of the very anti-inflammatory food and which need for the heart and everything. And fifth comes is a probiotic. So probiotic is, we always, our health depend on the gut. People like food is adulterated, people keep eating outside, food additives, so and so. So maintain your gut bacteria properly, at least you need a probiotic supplement depending on your lifestyle.
People will say curd is probiotic.
No, I don't think this is not enough. That's not enough.
Right.
But as the third is definitely a fermented thing, which is good. Still better is yogurt. But suppose, for example, if you're going out for a dinner, people have some drink or some other thing. Whenever you eat outside in the hotels and all, no, you see the color of the food. They will add coloring agents. They will have soup, sauce, and all other things. But so many ingredients will come into picture. When you're having so many ingredients like this, automatically your gut bacteria get disturbed. And for example, you're taking antibiotic, and nowadays people simply taking this acid blocking agents like pantoprazole, esomeprazole, and all. When you're taking these medications, then automatically probiotic is a must.
Right. And for diabetics, is there any special, like this is questions which we get, is there any special exercises, right, which you can do maybe after a meal or something to reduce your postprandial response?
See, after food, some people have a very high. Suppose if you had little more carb in the in your dinner, I suggest for such people at least walk 10-15 minutes post dinner,
Right.
because we cannot. It's not good to exercise immediately after dinner or any lunch or anything. At least after dinner or lunch, just walk 10 minutes, preferably in the dinner times. Walk 10-15 minutes, not more than that, so that your sugar spike will get reduced.
Right. Kunal, if I think we
Right.
can open up the audience.
One of the, yeah, I'll do that. In the meantime, can you talk about omega
Yeah.
6, sorry,
Omega,
omega supplements for vegetarians, because a lot of vegetarians do not prefer fish oil and all those things.
yeah. So then there's a lot of flax seeds and walnut is enough. Flax
Right.
seeds, regular intake, and the walnuts is a very good source of this omega-3.
All right. So we'll open up to the
And
audience.
also the chia seeds. See,
Correct.
the vegetarians, I recommend they must eat regular seeds and nuts. So they are the nutrition powerhouse.
Absolutely.
Mm.
So we'll open the questions to our audience. If anyone has a question, please type it, or you can switch on your mics and your videos if you like. Either ways. In the meantime, Doctor, can you tell our audience how to reach out to you and how to keep up with you on, online? How can people stay up with your work?
I'm in Twitter, but I'm not that much active in Twitter. And I have my YouTube channel. I keep posting some informative. Recently started. Otherwise, what happens is my most of time goes in practice only. So in the wherever the time's available, I'll make some videos and put it there. So in the Twitter, the inbox, and other thing, you can send messages if you have any queries.
Right.
Or there is a website also, drvishwanath.com. So that also, if anybody wanted to consult and all, they can reach out to me.
You're based in Bangalore, so where was your office?
I'm in JP Nagar, seventh phase.
Okay.
So I worked with all these corporates earlier. I worked with Manipal, I worked with Apollo. So, and I know in all the places, irrespective of the healthcare, the diet is the most neglected thing. I know in spite of the best hospitals, there was no concept of low carb diet. I see sometimes I was surprised to see diabetic people in the rounds, morning rounds, when you go to rounds, they're eating idlis, dosas.
So I think I have like a last question from my side. Like fasting insulin test, I don't think most doctors prescribe. Even if you go to a lab and ask fasting insulin, I think most of the time they will just tell it's fasting glucose and take that. So
Yeah.
why is this the case?
Because that is like uh, one is thing like lack of awareness about the preventive medications. In this, as a curriculum now in the MBBS, it's surprising for you. For example, I studied 5.5 years of MBBS and 3 years of post graduation. In the entire 6.5, 8.5 years, there was no subject on nutrition. So we are doctors on trying to learn the cause of disease and how to treat them.
Right.
So that's why this fasting insulin, home IR and all more of a preventive aspects. But now this awareness is keep on increasing. It is more popular with the people who follow functional medicines and preventive medicine like that. But still, many doctors don't recommend it. And some doctors think that the reference range is not accurate. What reference range you think is not accurate. And many doctors doesn't believe in insulin concept of obesity. 80% population is still believing in calorie concept of obesity. When people who understand the insulin basis of the obesity and other thing, automatically fasting insulin become more important.
Right.
So doctor, I have this question that usually when doctors prescribe medications, it's usually the time to see a patient is quite brief, But when it comes to holistic medicine, the doctor has to kind of put on a coach's hat also, a health coach to guide the person, to give the knowledge, educate the person. So in these cases, like what are the biggest challenges you face? Can you
This
just
always quite happens in any practice, busy practice. Even I see when I see the patient, I for example, I cannot spend more than 15 minutes. So what we did is in my clinic, we have a separate low carb diet team. So I will explain about the synopsis of the diet and I'll optimize this medication and other things. I'll speak about reports and other things. Then for a diet follow, I'll refer to them because I'll tell them it needs separate follow up. But some people is already having their own nutrition coaches and all. I will tell them, I'll give this guidelines. At least this much protein you require, this much this one. You consult them and follow the diet properly. Automatically in India, this problem is if the people still not motivated enough to have this preventive medicine and all. And if you keep spending for half an hour, 45 minutes also, difficult to manage because the numbers also more wherever we go.
absolutely. So anything else you want to share, doctor, before we wind up?
So maybe the most thing is the diet. Instead of speaking about a low carb diet, we can have to start convincing the patient that see the nature has given three macronutrients: carbs, protein, and fat. Don't overconsume fat. At least eat them in equal proportion. Even if you eat carbs, protein, and fat in equal proportion, at least, and automatically it becomes a kind of a low carb.
Right.
So don't do anything in extremes. Ultimately, motivation is the key. What happens in the today is till 1980s there was no diet guidelines at all. The first diet guidelines came to US in 1980. Imagine after diet guidelines came, more and more people becoming metabolically unhealthy and diabetic. 1980 to 2025, every decade the diabetes is increasing 4 times.
That's true.
So indirectly what I'm saying, we are living in a high technology era. We are living in a people where enough dietitians and nutrition coaches are there. Still, the incidence of metabolic problems and diabetes increasing because one is lack of motivation to follow it, and people are eating and following a lifestyle without awareness. Like if somebody is eating idli, dosa, upma, paratha for a breakfast, that's it. And very few people will take an interest to know what exactly paratha contains. You see, no, the people, suppose if you somebody you're seeing your circle, so if you want to shop for a shirt or some jacket, they know 10 brands. And if they're buying a car, they know the details from engine specification to the outrust to the car company and all. But when you come to your own blood parameters, your own diet, what you're eating daily, the people have a least knowledge about it. It starts from the interest and motivation. If they have interest and motivation, then only they can increase the health span, not lifespan. Today I was saying in the ICUs, I keep saying 80 years, 90 years patients, they're in ICUs. Now the lifespan is increasing. People live up to 90, 100 years also. But they live healthily only till 50, 60 only. As per the research, only the people spend 25% of their whole lifespan in diseases only. And if they can seriously have a motivation to follow this, they can live 90% of their lifespan as a good health span.
Right, right, doctor. With that, I think thanks a lot for sharing very, very practical and very valuable insights for our audience. And we really appreciate, giving us this time to come on our podcast. Thank you so much. We wish you all the best, and we'll keep in touch. So thank
Yeah,
you, doctor.
Thank you.
so when they was messaged me in the Twitter, I said yes because my intention is we have to spread this awareness more and more. I'm really thankful to you guys, even though you're not from the medical background, you're doing your best efforts to do so. And the Mind Muscle project, this was one of the best Twitter account where you're giving so much of details and all. Many times I wish to do like that, but I don't have much time to do this. This is really good. This awareness should spread. So I have spoken to many low carb dietitians and other things. And let's not make this a low carb as another diet term. Let's address macros properly. That's all.
Right.
That when you address this body's macros as per the body physiology, that automatically it will become low carb.
That's an excellent message. Let's
Yeah.
not start another diet culture.
Yeah. Because many people are averse to this diet concepts. So many people know the market has become like this, like every dietitian has their own diet. And all. And we can say it's not at all a diet. It is the art of eating. You must be knowing, I tell my patients, at least after having this diet, counseling, everything, when you see the plate, you should be knowing what you're eating. What is your protein you're eating? What is the carbs? What is the fiber? What is the fat? If you have this basic awareness, by default, you continue that for a long time. Many people are not at all aware what is protein, what is fat, what is carbs. Many people think that I'll have idli with dal, I get 20 grams of protein per day, per particular meal. This is the ignorance even in the educated class. And this is a major suffering also. And even I don't understand many, even the best of the hospitals, even a simple low carb diet is not followed. They serve, imagine you tell me any one hospital, I tell them in the big hospitals, they serve diabetic patient with the idli dosa in the breakfast. How it can be low carb? Because automatically it will spike the sugars. Because this concept needs to be widespread, and appreciate you people are doing this. And anywhere, any sessions like this, I'm always ready. Thank you.
Thank you.
Thank you.
Thank you.